Did you know that the majority of the population lacks vitamin D3? And neither food nor sun exposure can provide us with adequate levels? In this video, I will talk to you about its functions, why a deficiency occurs, and how to maintain appropriate levels. Hello, I am Dr. Navarro, and before discussing vitamin D, we should understand that vitamin D isn't actually a vitamin. The term vitamin consists of two parts, vita and amine. Amine signifies a substance essential for life and health. Unlike vitamins that we cannot synthesize ourselves and must obtain through food, vitamin D is not a vitamin as our bodies can synthesize it. All it requires is cholesterol and sunlight. Whenever we are exposed to the sun, ultraviolet rays penetrate our skin, transforming cholesterol into a substance called cholecalciferol. This compound is stored in our adipocytes, or fat cells, and once stored, it requires a protein to transport it to the liver for release. In the liver, it remains inactive. To become active, it needs to move to the kidneys. There, it transforms into calcitriol and becomes active, subsequently spreading to other organs. We mentioned that vitamin D is not a vitamin, so how does it truly function? Vitamin D acts as a hormone. Hormones are substances with numerous roles in the body. The primary function of vitamin D is to maintain calcium and phosphorus levels in the blood, achieved through various pathways. The first is the intestinal absorption of calcium and phosphorus in the small intestine. Another pathway involves reabsorption by the kidneys and reduced elimination through urine. A third pathway involves moving calcium and phosphorus to bones and teeth, which contributes to their strength, health, and growth. Furthermore, this mineralization of calcium and phosphorus in bones and teeth protects against conditions such as rickets in children, fractures at any age, and osteoporosis. Vitamin D's second function is cell differentiation, which increases cell numbers and supports growth. However, this growth isn't uncontrolled. Vitamin D precisely regulates cell proliferation, as uncontrolled proliferation could lead to mutations and the development of cancer. Vitamin D affects 36 organs and tissues in our body and has more than 400 receptors. Receptors for vitamin D3 exist in various organs, such as the brain, stomach, small intestine, large intestine, bladder, kidneys, prostate, breasts, T lymphocytes, vascular walls, and smooth muscle. The third function is an increase in muscle fibers, benefiting athletic performance. Vitamin D3's role is that of an epigenetic regulator. When it enters cell nuclei, it triggers a cascade of reactions that activate transcription of our organism's genes. Vitamin D3 acts on around 900 genes in our body and also increases telomere length, which are vital parts of our chromosomes. Shortened telomeres contribute to aging. Hence, vitamin D3 helps prevent aging. The fifth function lies in vitamin D3's immunomodulatory role. It affects both autoimmune diseases, such as Parkinson's, multiple sclerosis, and thyroiditis, and allergies, skin diseases, and the immune system, particularly in the respiratory tract. Increased vitamin D3 has been shown to influence respiratory system cells, reducing disease incidence. In the past, tuberculosis patients were exposed to sunlight to decrease disease prevalence, and the same applied to asthma. Vitamin D3's sixth function is maintaining cardiovascular health. On one hand, it enhances myocardial fibers, improving heart contraction. On the other hand, it controls arterial hypertension by directing calcium to bones instead of arteries. Another function of vitamin D3 involves the pancreas, where it increases insulin production. A deficiency in vitamin D3 leads to decreased insulin levels. An equally significant function is its observed role in decreasing prostate and breast cancer incidence. The final function I'd like to discuss is vitamin D3's importance during pregnancy. By increasing insulin secretion, it reduces gestational diabetes risk. Vitamin D3's role in controlling arterial hypertension reduces the likelihood of preeclampsia, a condition characterized by high blood pressure during pregnancy. Thanks to vitamin D3, there's a lower rate of premature births, reduced instances of eczema and colds in babies, and decreased postpartum depression in mothers. Now that we've reached this point, how do we determine if we have a deficiency in vitamin D3? Essentially, through a blood test. This test shows vitamin D3, calcium, phosphorus, alkaline phosphatase, and parathyroid hormone levels. Between 6 and 12 months of age, signs could include delayed sitting or crawling, and changes in chest shape. Anteroposterior narrowing in the front to back area, narrowing above the breasts, and widening at the base could be observed. In advanced cases, a rosary-like formation could indicate calcium deficiency and a lack of vitamin D3. Passing hands over the ribs and feeling bulges could reveal this. Delayed tooth eruption might also be noticed. From 12 to 15 months of age, during the walking stage, signs could include the baby not walking, delayed fontanelle closure, delayed tooth eruption, or a tendency toward fractures. Severe vitamin D3 deficiency in children causes rickets. Rickets is mainly characterized by bowed legs, muscle and ligament weakness, and delayed and deficient tooth development. Later, during adolescence, youth, and adulthood, various issues could arise due to a deficiency in vitamin D3 and its functions. These could involve muscle weakness, muscle pains resembling fibromyalgia or chronic fatigue syndrome, increased risk of diabetes due to reduced insulin production, various bone lesions, fractures, tooth abnormalities, autoimmune diseases, immune system disruptions, and numerous cardiovascular and hypertension-related conditions. Who might experience deficiency? Firstly, it depends on skin type. Dark skin, with higher melanin content, acts as a barrier to ultraviolet rays. Individuals with dark skin may require 7 times more sun exposure than those with light skin. Age can also contribute to vitamin D3 deficiency, as aging skin loses its ability to absorb ultraviolet rays and synthesize the vitamin. Additionally, decreased kidney function affects vitamin D3 activation. As we've seen, vitamin D3 is stored in adipocytes, our fat cells. People with obesity retain more vitamin D3 in these cells, preventing its release into the bloodstream. Intestinal, liver, and kidney diseases, as well as the use of drugs such as antiepileptics and corticosteroids, can interfere with vitamin D3 metabolism and lead to deficiency. Other factors indicating vitamin D3 deficiency might be linked to external factors inherent in our lifestyle. Living closer to the tropics versus the poles, working night shifts with limited sun. Exposure, excessive clothing, and overuse of sunscreens all impact deficiency risk. Evaluating whether there's an unbalanced diet is crucial. So, what foods contain vitamin D? Primarily, cod liver oil, liver from various fish, fatty fish, shellfish like oysters and shrimp, sun-dried mushrooms, eggs, dairy, and milk. These are the sources of vitamin D3 absorbed through food. However, sunlight produces vitamin D3 that lasts twice as long as dietary vitamin D. Obviously, sun exposure with minimal clothing, and never through glass or windows, is best. If dietary intake and sun exposure are insufficient, as is often the case with young babies who cannot be exposed to the sun for extended periods, vitamin D3 supplementation becomes necessary. Vitamin D3 is a fat-soluble vitamin. It needs to be dissolved in fat. Supplements are oily and come in liquid form. So, for young children, infants with breast milk intake, vitamin D3 supplementation is necessary, as breast milk doesn't provide adequate amounts. Even with formula feeding, during intense growth periods and teething, vitamin D3 supplementation is vital. Daily intake is better than weekly or monthly doses. Dosages depend on deficiencies and age. For a newborn, doses could be around 400 units. For older children, this could increase to 600, and later even up to 1,000. Adults might need between 1,000 and 200 units daily, but it varies based on specific conditions. For acne, you might use 4,000 units, for depression, 5,000 units, and for autoimmune diseases, even higher. As we've seen, vitamin D3 isn't just a vitamin, it functions as a hormone, impacting 36 organs and tissues in our body. We've also learned that its deficiency leads to bone and dental issues and the development of numerous diseases. While our diet provides limited vitamin D3, our body synthesizes it thanks to cholesterol and sunlight. If this isn't enough, supplementation is necessary. While we often think of substances playing a pivotal role in our bodies, vitamin D is distinct. Being an epigenetic modulator, it provides access to hidden biological treasures in our DNA. If you found this video helpful, please hit the like button, subscribe, and click the notification bell.